Did you know that jaundice isn't actually a disease? It's more like a warning light on your car dashboard. Something's wrong under the hood, and it's time to figure out what. Welcome back to Reem Healthcast. Today, we're diving into this fascinating and often misunderstood condition, jaundice.
That's such a great way to put it. I think most people hear jaundice and immediately think it's a standalone illness, but it's really a symptom of something deeper.
So, what is jaundice?
Jaundice occurs when there is an excess of bilirubin in the bloodstream. Bilirubin is a yellow pigment produced during the normal breakdown of red blood cells. Under healthy conditions, the liver processes bilirubin and excretes it through bile into the digestive tract. When this process is disrupted due to liver disease, bile duct obstruction, or blood-related disorders, bilirubin builds up in the blood. This leads to the characteristic yellow discoloration of the skin, eyes, and mucous membranes. So it's like a traffic jam in your body. Either too many red blood cells are being broken down, or the liver can't keep up, or there's a blockage somewhere along the way. And that buildup is what causes the yellowing. And depending on where the issue lies, doctors categorize jaundice into three main types: prehepatic, hepatic, and posthepatic. Each one points to a different underlying problem.
Let's break those down.
Prehepatic jaundice happens before the liver even gets involved. It's when red blood cells are breaking down too quickly for the liver to process. Conditions like hemolytic anemia or certain genetic blood disorders can cause this. It's like the liver is being handed more work than it can possibly handle. And then there's hepatic jaundice, which is where the liver itself is the problem. This is probably the one most people think of when they hear about jaundice. Things like hepatitis, cirrhosis, or even liver damage from alcohol or medications fall into this category. And finally, posthepatic jaundice, also known as obstructive jaundice. This is when something blocks the bile from flowing out of the liver. Gallstones are a common culprit here, but tumors or inflammation in the bile ducts can also cause it. So depending on the type of jaundice, the treatment and management will vary a lot.
But before we dive into treatments, let's talk about symptoms. How do you even know you're dealing with jaundice?
The most obvious sign is that yellow discoloration of the skin and the whites of the eyes. But there are other early symptoms to watch for, like dark urine. People often describe it as tea-colored, and pale or clay-colored stools. Fatigue, weakness, and even mild abdominal discomfort can also show up. And if those symptoms are paired with fever or significant abdominal pain, that's when it's really time to worry. That combination can point to something much more serious, like an infection or inflammation in the liver or bile ducts. Jaundice on its own is already a reason to see a doctor, but when you throw in fever or pain, it becomes a medical emergency. It could indicate acute viral hepatitis, a bile duct infection called cholangitis, or even a liver abscess. These are not things you want to ignore.
And diagnosing jaundice usually starts with blood tests, right? What are doctors looking for in those tests?
They're looking at bilirubin levels, total, direct, and indirect. They'll also check liver enzymes like ALT, AST, ALP, and GGT to see how well the liver is functioning. A complete blood count can help identify issues like anemia, and they might do viral hepatitis screening or coagulation tests to get a fuller picture. Imaging studies like ultrasounds or CT scans are often used too, especially if they suspect an obstruction.
It's fascinating how much information they can gather from just a few tests. But what about jaundice in newborns? That seems like a whole different ball game.
It is. Neonatal jaundice is actually pretty common. Most newborns experience some level of jaundice in their first week of life because their livers are still immature. They're not processing bilirubin as efficiently as an adult liver would. And for most babies, it's not a big deal. It resolves on its own as their liver matures. But there are cases where it can be more serious. Jaundice in newborn may have different types according to the underlying cause of it. If bilirubin levels get too high, it can lead to complications like kernicterus, which is a type of brain damage. That's why doctors monitor newborns closely if their jaundice seems severe or prolonged. And in those cases, treatments like phototherapy can make a big difference. That blue light converts bilirubin into a form that's easier for the baby's body to eliminate.
And speaking of treatments, let's circle back to jaundice in adults.
The key to managing it is treating the underlying cause, whether that's an infection, a blockage, or something else entirely. And diet plays a role too. A well-planned diet can support liver health and recovery.
Speaking of jaundice diet, what to eat and what to avoid.
Foods like fresh fruits and vegetables, lean proteins, and whole grains are great for liver health. On the flip side, you want to avoid alcohol, fried and fatty foods, and anything overly processed or sugary or supplements without medical advice. But it's not just about food. Lifestyle changes, regular monitoring, and sometimes even surgical interventions are part of the care plan, depending on the situation.
That's true. The important thing is to act early.
Jaundice is a warning sign that something's wrong, and ignoring it can lead to serious complications like liver failure or chronic liver disease. It's one of those things where awareness really is key. If you notice the symptoms, don't wait. Get it checked out. Early diagnosis and treatment can make all the difference.
Couldn't agree more. Well, I think we've covered a lot today. From what jaundice is and its causes to symptoms, diagnosis, and treatment options, it's clear that this isn't something to take lightly.
Definitely not. And I hope this conversation helps anyone who might be dealing with jaundice or even just curious about it to understand it better and take the right steps.
A big thank you to our listeners for tuning in. Stay tuned for our next episode, where we'll continue bringing you practical, easy-to-understand health topics. Until then, take care and stay healthy.